First of all, neurologic testing will need to be taken care of to determine the cause of your drop foot. Once the cause is determined, then treatment will be started for that condition. If it's your spine, then you'll need to potentially see a spine doctor, and often in circumstances where that occurs, you may need an injection or sometimes even surgery to open up the space around that nerve. And that's something that I would consider doing fairly early on if a drop foot has occurred because of that. In addition, other treatments that your doctor will prescribe will include a custom brace initially, which can be a brace that's made out of plastic materials that holds the ankle up and slips inside the shoe. Usually that brace is going to be up almost to the knee in order to be able to hold the foot up adequately. And that's a very appropriate brace and can be very effective in improving the way that you walk. In addition, there are other types of braces similar to the Elevate brace. They can help to suspend the foot, and your doctor can decide if you're a candidate for something like that. Physical therapy can also be very helpful in retraining muscles and in stretching the ankle. One of the biggest problems that occurs with drop foot is the loss of ability to suspend the foot causes the foot to be stuck in a downward position over time because you're not pulling it up. And once it becomes stuck in that position, it can be very difficult for even a brace to help it. So physical therapy can be very effective in maintaining the motion and giving you ways to be able to hold the foot while you're waiting for those muscles to become more strengthened or at least to return to some level of function. In addition, there are surgical treatments that can be helpful for drop foot. If bracing has failed, or if you are seeking a way to be able to function without the use of a brace, then occasionally surgery to transfer tendons from the back of your ankle to the front of the ankle to use those muscles to suspend the foot can be effective. It usually doesn't create a strength that would be the same as what you had previously, but it can be much better than it has been. And sometimes when augmented by a brace similar to the Elevate brace, it can be very successful in giving you a very good level of function.